board. Sinajana Mayor Robert Hofmann. Morning, Mayor.
Hafidi, good morning.
Good
Thank
morning.
you for playing that Hagu song. It's a nice song for one written by one of our Sinajana's very own, Flora Bazaquan.
There you go, and that's great. There's a lot of different covers of that one. That's one of the ones that I really dig. Mayor, let's just start on the cleanup. So I'm sorry, forgive me. You're the vice chair, right, of the GBB board?
Yeah, so we're talking about, no, I'm the vice chair of the beautification task force.
Okay, I got you.
And so on that, so we actually are having this discussion this morning to see, we are getting people texting and calling, asking, what's going on. We are going to, we're, as far as I know, we're still proceeding social distancing. We have about 1,100 plus volunteers, but everyone's going to be broken down into little groups spaced out well. Like my family's going, and we're just doing a stretch of road by ourselves, get to get our bags, do our thing, and then kind of work from there. So, but we'll leave it to the rest of the powers that be and the people that are going to make the recommendations. I think we're all waiting for the groups to meet this morning, the physicians groups and public health, to figure out if these positives were a cluster or are they individual homes itself. Because, in the last 2 weeks, we've had protests, we've had waves, we've had the reopening of the churches. Yeah. So it could be anything. It could have been anything.
Father's Day.
So, Father's Day, and then the I guess the growing from 10 to 25 to 50 in the gatherings. So, and there's been a lot more funerals that I've seen people actually attend. My uncle himself, when he passed, different. So I think it's these things we're trying to see what these cases are and where they came from in that, and then they have about 500 more tests they still need to run.
Yeah,
so
from Jotnia.
that's one thing.
Yeah, that was the turnout at Jotnia was insane. I mean, it went from.
I don't know if it's all Jotnia or it's a mix of others.
I'm sure there's a lot of Southerners, right? But it went from the church at one point all the way past the feed store, almost a 7-day supermarket.
With that, because I think their capacity is they can only do 60 to 80 in an hour, because it takes time to fill out the paperwork and to do it. Because we tried to we were all trying to set our records and get people out to do turnout. But most of the time, it's always between 240 to 260. That's why you've noticed that every time they do the village results, because that's pretty much based on the capacity of public health to do these things through. If you had 4 testing stations or, whichever. So I was shocked to see the 500 number, but we'll find out where those actual breakdowns are, because sometimes it just clusters saying, okay, this is Jotnia, but it could be somewhere. And one thing that I was talking about this morning is I really think that the military should kind of step up, and since they broke the protocol, they should come out and start testing those businesses and restaurants and their families too. I think that's a good way to do that. If I was the admiral or the general, I'd be like, get your testing team out there. Right. We need to fix this too. And so it really shouldn't just be relying on public health. If they have the capability, they should be out there testing. And I think
one Guam, guys. I thought you said it's one Guam. Where you at?
Has anyone made the ask?
I don't know. Maybe I'll do that here. I don't know. My lonely position as a mayor of a small town, military, if you're listening, I think it'd be incumbent on them to do that, especially the fact that they visited so many places at that one time. I think it would not necessarily bring some sense of comfort, but it makes them take responsibility for the action.
Right.
In that sense, to say, hey, you know what, if you're a business and you're here, come over to the Naval Hospital or to the military gate, or we'll come out to you and tell us where you work, and we're really sorry, and we want to see you and just make sure you're safe.
It kind of seems like they're doing the opposite. They're just turtling in. They're just like, no, we're going in our shell.
Yeah. Nobody come out the gate.
Right,
Close.
yeah. Nobody go to the restaurants or the bars.
It's like the medieval times. Raise the drawbridge.
Right. Mayor, that's funny. Let me ask you, so you said that people are talking about this cleanup, that you're waiting on the groups to meet. You're waiting on more information about these 15 positives and whatever results we get today. It kind of sounds like there might be a chance that this thing could be called off.
It might be postponed, but right now, no, we're waiting. I think we're still ahead. I mean, remember the last time we had that huge number? I think it was in Jigo. It was in a household. Right. So it was able to kind of understood.
Right, but we had Dr. Hoa on earlier, and he said that they were scattered, that a lot of these cases were not connected to each other.
Yeah, and that's why we're asking for more information of where did they, in these last 2 weeks, were they part of protests, part of churches, part of this? Because that will kind of tell you where that spread is,
right.
I guess, and so that's kind of what we're asking and what we're requesting for is, where is this? Because, we're going to start backtracking is going to be the hardest thing that public health has to do. I feel for them. And this is where we can probably reassign some of those non-essential agencies to start going up there. And I understand all about HIPAA and everything, but I would be like, you know what, just go up there and start making calls and find out where.
This is like a recurring theme. Mayor's asking for more transparency and information. I think I heard this one before.
Here's a good oldie but goodie hit.
Right. The SIT report comes out like around 11 to 1 or something like that. But even still, it doesn't have like a whole lot of specific details in the SIT report. All it's like, oh, we might have contact to a confirmed case or no contact at all.
Yeah,
that's what we saw yesterday.
Yeah,
right? Breathers. What was that?
Which one?
There was one case, one female
who had contact, and then the rest, I think it was like the 3 others or 4 others, no contact.
Yeah, so it's a challenge for us to even also when we get that. So we're asking for more. It's slowly but surely we'll see, and we wish Linda well on her her retirement. I know she's.
What'd you hear, Mayor?
I know she cares for her father-in-law.
Right. Yeah.
Who's very sickly, very elderly. He's a wonderful man, and so. I know that they all co-shared, and co-helped out this, and for the past few, she's been quite busy. So, and I think she hasn't been able to be around the father-in-law, considering her position everywhere she is at what her
Mayor, I'll text her at like 8, and she'll be like, "I'm still at work. I'll get back to you. Let me find out." Mm-hmm. I mean, like, and that's like the
very demanding job. So,
right? Yeah.
If there's, I'm sure that. The front office is actively looking for replacements for that and for other other agencies that have that. But
what do you think, though, Mayor? Because in the comments, people are saying, "Oh, everyone's abandoning ship." What's your read on it? Do you think it's just a bunch of coincidences?
Most people don't last long in any type of government. 18 months is usually the thing. It's stressful. You kind of sacrifice a lot of your life into doing a lot of things, and nobody expects. Most disasters like typhoons and other stuff, they last a little bit. You do your thing, you go. This has just been the long haul. This is the marathon of, emergencies. So it takes a toll on people. And so I think, for her, it was probably a hard decision. She was up to the challenge. She's up to the challenge. She did it since day one, and everything else that they're trying to do. I know they've made great strides in some points compared to the states and other territories, but at the same time, you're faced with this is government, this is people's attitudes, this is all these other things. So for her, but it's her personal reason. I'm not going to second guess why, but I think retiring either for medical, caring for a family member is always something that's hard for somebody. But caring for a family member, that you're doing God's work that way. It's hospice care.
Right.
It's never easy. If anyone's ever cared for somebody sickly or in bed, that's one of the hardest things to do, is because you basically I have a friend who cared for his sick mom and his aunt for basically all his life as a kid, and his mom just passed away. And I told him, I said, "What are you going to do now with your life?" He goes, "I don't know. I've always just been a home hospice care."
Right.
And so it's a reality check for him, and he's happy the mom is finally resting, but at the same time, it's like, what do I do with my life? I've never had a social life. After school was, taking care of this, doing shifts, and so it's hard to do hospice care. But I wish her well, and we wish all the others that are leaving for whatever reason. We wish them well. Those are their decisions.
I wanted to follow up with the homeless situation. I think aren't you with the Guam Homeless Coalition?
I'm not in the Homeless Coalition, but I'm tasked by the Mayor's Council to help during this emergency pandemic. I know that they're actively out looking for facilities, properties and places, and trying to gather all the agencies that receive some type of CARE Act funding to deal with specific issues regarding homeless and poverty. So it's kind of bringing everybody together.
The Lieutenant Governor, he said that by Monday of this week, that he should have some answers, but we're still waiting. This is like the 4th iteration of trying to find a hardened shelter. We heard from a mayor earlier this week. Which one was it?
It was
Mayor's Council Executive Director
Angel Sablan said there was a Mongwong Taltu Mighty.
And yet
we were looking at that, and then I think the issues are also, it's GSA also has the final say in terms of things, and it's just there's not many available spaces where they're all in together. There's not one place that's like, oh, all 100 units or 40 units are empty. It's going to be a mix of people here and there. So it's harder for either the people, the nonprofits or the agencies are going to be watching it to be deployed to several different areas to do these things. So, you know, a lot of the things that are part of this emergency services will be food, will be how do we, you know, get them to do the other things there, protection, protecting the neighbors and stuff.
But John Birch, when he was the director of Parks and Recs, and they kicked out the homeless in Paseo and other parks so that they could, you know, start cleaning up. What are we going to do tomorrow? Because we're hearing that, you know, some of the homeless people are still in Agana at Paseo.
Yeah. So what yesterday, last night, we had conversations with the mayors about the opening the use of their gymnasiums, as well as we do in typhoons in terms of tier 2 shelters. That was one of the discussions we had. What we're also finding is some of these gymnasiums have plumbing issues. They're very hot. And, you know, there's a whole bunch of other issues. Some of them, the roofs leaks, they were actually supposed to undergo construction and reconstruction. And several of them through a Parks grant that was given about I think it was more than a year ago. So kind of the timing became very bad. So it's still something we're actively looking at. So the next, you know, but that was the discussion today was check your colleague mayors. And we did. I had discussions with, so we suggested, how about the Dededo Sports Complex area, you know, because I think they're going to give, I think right now we're trying to do the priorities of that, you know, families and then, you know, go down that line. But that's one aspect of it. And then it's, like I said, the agencies finding out what kind of CARE Act money they have that can go to this specifically. Right. And then finding the right balance of how much are we willing to pay, where we're not going to say, you know, if you're going to pay for a shelter that's going to be like, you know, $1,500 to $2,000 a month, you might as well give the person a voucher to rent a house on his own, you know. Why a 1-bedroom or a 2-bedroom, or, you know, or do we do it in a communal setting where you just get one room in a house of 4, you get one room, and we just all have this communal space, and, you know, they kind of do that. So it's how to proceed safely because of Corona. That's going to be the hard part, is keeping everybody within that. And then what do they do with their daytime now? You know, if they're leaving their things there, where do they go? Are they going to just hang outside the neighborhood and, you know, are they going to hang outside the...
Mayor, it sounds like we're not going to get or are we going to get a resolution this week? Because LT said yes. DPW Deputy and Acting Parks and Rec Director Jess Garcia said, yep, this week.
I know that they are out. I know they did meet with landlords. They've met with realtors. They've met with people. I know GSA's out there. All 3 groups are doing their work and out there. And same thing with us is, you know, I wait for my assignment, I go do it, and I come back and report. And that was my report last night was, you know, we have plumbing issues, we have these other issues here. Then some of the schools are located where the grab and go is still happening. And there's also, you know, the talk of the summer, how do we do the summer classes and stuff. So those are some of the issues we're facing. And then, you know, feeding them, the logistics of it, and then who's going to help do this and help them organize it, because it's hard for the government to do it in a way if everything's kind of open and back to normal.
Right. Yeah, I think 3 months is not a long enough time to plan something out like this. So
that's sarcasm right there.
Oh, yeah, and that's the thing is that, you know, I always tell people that it's 104 days of amassed, and, you know, yes, granted, this is very new for everybody here, but some of the times just anticipating things. So I'm a logistics guy. I like nerding about logistics and trying to figure out. And so I'm anticipating for the next thing. And the next thing is, how do we shore up and stand up some of these services faster? Because God forbid it would have been something that required it immediately. Where, you know, what if there was a super typhoon and, you know, suddenly you had thousands of
typhoon season.
How do we do this and how do we shore this up? So, you know, we're learning. Are we doing the best job of it? We're trying on our end. The other agencies are trying, but there's restrictions here and there. And it's hard when you're a small island and you're limited to sole sourcing and, you know, limited to the availability of spaces. And, you know, you can't truck in a bunch of trailers from another state that's not being used. So we do have our challenges here.
But we've also learned that you can totally bypass procurement rules when you have superpowers. So you can do...
When you're a soldier and you can,
you know,
yeah, that's not. There are processes for some of these things, and so I think with housing specifically, it falls under a different region, different oversight, and I think those guidelines. I think I remember reading it. That those guidelines are still the same, no matter.
So are we going to kick out homeless people today, get them out of the way, so that we can do this cleanup tomorrow?
I don't know. That's my department on that end there. So I'm just trying to figure out our end here and trying to get as many as we can. And so,
But the latest plan is now, or that's circulating. MTM is out, and maybe the Dededo Sports Complex.
Is MTM
is that the?
officially out?
I don't
now?
know. No, I don't know.
Okay.
I don't know. I was just asked to look for other places while they're trying to secure other places. So we're actively engaged in talking with them because that was the natural choice, was the tier 2 shelters. But now that we know the condition that the shelters are not even capable of doing long-term type of care, a few days like a typhoon, it's pretty easy to do. It's the longer term of, how long will you need this?
And I think that's what the governor said in the last press conference. Was she's like, I don't want to just house them. I want to
Wrap around
house
services.
them and get them jobs and
if they need, they need to go into drug rehab programs or other things. And so, the discussions are there and they're taking place.
For the last 3 months.
Yeah.
Okay.
Okay, Mayor. I know we got to ask you about this whole COVID differential pay. I don't know if you saw the story, but I mean, it was funny because Bree and I, we weren't disagreeing about this. We just brought up different points, but I thought I was thinking about it last night. It was like, we have basically been praising you guys for how hard you've been working during this COVID pandemic. We know that, you're out there delivering meals, coming into contact with people. You don't know if they're COVID positive.
Yeah.
And so I really felt like you would be able to justify not just you receiving the COVID differential pay, but so many of your colleagues on the Mayor's Council. So we'll just give you the floor and go ahead.
Thank you. When we kind of saw that, it was, we're saying, okay, well, first of all, it's 15% on our hourly. It's not a year's salary. I think so we were saying 50% of 75,000. It's like, no, unless this thing lasts for a whole year, then maybe, but it's not on that end. But it's paid by DPHS, by Public Health through the CARES Act, through their funding, and it was given to them, I guess, for local governments. They were able to see how it's done on that end. It wasn't an ask of the Mayor's Council at all. It was saying, give us everybody that's working COVID, tell us what they're doing. So some of the things we were doing is, within the first week, we were securing and cleaning and decontaminating our facilities. And then we were always doing, periodic checks on the parks, enforcing social distancing. You saw the litter pictures. Those are the things kind of we were doing on that end. And, these are actual mayors doing it. Some people say, oh, it's not the staff. You saw mayors out there doing it as well. For me personally, I use my POV. We delivered meals to the homeless twice a day. That's what we've been doing, since then. I use my own gas on that end. We're helping do all the recreation stuff, businesses, packing, and, helping curb a lot of stuff. We still carried on our duties as that, but these were the additional COVID duties. We coordinated with agencies and departments for the logistics to include the grab and go, the DOE, education stuff that we had to send out there. We did the TFAP lines and the lunches, and we're still doing the lunches. Actually, if you go to several districts, you're going to see the mayor out there helping with the grab and go line. That's what they're doing. We're assisting the schools a lot more. And we had for the last 3 weeks, the USDA fruit boxes. And I know Mayor Savard.
Yeah.
You guys should have just handled the homeless shelter. My
Right.
goodness.
And then the Mayor Savard personally was transporting patients from the hospital to their homes. And, that's in her car. And she's like, I'm going to get corona. I just know it. And, it's hard because these people don't have family or facilities, or people are like, oh, I'm not picking them up because, they just got released. So we know that's happening there. We organized the drive-through testing with Public Health. We're helping DPHS do the tracing and backtracking. We're actually even showing them physically where some of the houses are, going door to door. We did the Manumco food. That was one thing we did, and then for like us in Sinajana, my vice mayor, we put up the help center, and he's been doing interviews and doing intake. So there are things a lot of the mayors did not see. We don't go around taking pictures, putting it on Twitter, and saying, "Look at me! This is what I'm doing."
Making
We
videos.
do our jobs. We get in, we get out. We're, that's what
You
we
guys
do.
need a video guy. Like, maybe we could borrow Adaloop's video guy.
Well, we were actually talking about it on Tuesday in our little meeting. We said, you know what? Instead of liberation, we were going to personally all pay for an ad to really thank our employees, because everybody's always thanking the doctors, the nurses, which is granted,
Right.
yes, they are, but it's you don't see much videos of us saying thank you, mayor's people, for
Right. No,
trying
thank you to
your
the
best.
mayor's staff. I know all the mayor's staff. They work very, very hard, man.
I
Hard
appreciate you
and
giving
never
us the time.
stop. Essential all the way. I got it.
Yeah, and the thing I was like, they say, why do you get 50%, Mayor? I said, because I got to call Chris Barnett and Sabrina in the morning, and I'm not even on the clock yet.
You don't even know what they're going to ask, right? Yeah.
I'm just teasing. No,
I got you. Well, thanks.
Appreciate it.
Hey, keep us posted on the cleanup. If there's going to be a postponement or what, we'd like to know.
I will. Appreciate it.
Because
Thank
we're
you.
scheduled to clean too. We signed up.
I mean, I'm kind of like 15 positives. I mean, I'm not saying that's my excuse, Bree, but I mean, it is what it is. Okay.
Yes, we will, and hopefully maybe the military steps up to the plate and starts doing testing as well.
Right.
There
Good
you
call. Thank you, Mayor.
Thank you.
So wash your hands.
Sure.
Okay.
Bye-bye. I will.
All right.
And wear a mask.
And wear a mask. 8:02. We'll take a break, come back, do our anthems, jump into the news, and then we have Lillian Posadas from the Guam Memorial Hospital. We'll definitely ask her about that COVID hospitalization. And Attorney General Levin Camacho also coming on. And then a lot of crime, unfortunately, a lot of crime going on. So we'll catch up with Sergeant Paul Tapao of the Guam Police Department. It's the KUAM News Takeover, Guam's favorite, containing COVID, Biba Betnet.
Restaurants across
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self Storage.